Okay, Medical Uncertainty by Kelly Berenfeld.
Brianna Armstrong.
And Beth Griffin.
All right. So medical uncertainty is frequently encountered in medical practices and causes stress in both patients and physicians. Medical uncertainty can be caused by miscommunication between patient and physician, lack of trust in a medical environment, cultural differences in communication, and through diagnosing of a patient. Types of uncertainty in medical students. So uncertainty in medical school can be prevalent in prior knowledge, uncertainty in actions, and uncertainty in perceptions. Medical students may experience uncertainty through their awareness of not being able to learn everything about medicine, their realization that limitations do exist in current medical knowledge and techniques, and that problems distinguishing between personal ignorance and limits of available knowledge may be prevalent as well. So, evidence-based medicine has been implemented into certain medical schools as an attempt to reduce uncertainty in the medical field. The benefit of evidence-based medicine is that clinicians listen to patient concerns and take them into consideration to determine the appropriate treatment plan. Evidence-based medicine combines clinical expertise, which is what the clinician knows, best research evidence, which is what the literature says, and patient values, which is what the patient wants. Physician-patient communication. A major barrier to effective communication lies in the differences between physicians and their patients with respect to status, education, professional training, and authority. These factors all may contribute to why there may be some miscommunication. Effective communication in medical students will reduce uncertainty, provide a basis for action, and strengthen the physician-patient relationship. Both verbal and nonverbal communication are important in developing patient-physician trust. So where do we see uncertainty in the medical field? There's something called diagnostic uncertainty, which can be defined as a subjective perception of an inability to provide an accurate explanation of the patient's health problem. We also see uncertainty in the medical field through cultural differences in communication, cultural differences in explanatory models of health and illness, differences in cultural values, cultural differences in patients' preferences for doctor-patient relationships, racism and perceptual biases, and linguistic barriers. We also see uncertainty with physician and patient trust. Trust should serve to reinforce the functioning of the clinical relationship as a healthy partnership, thereby increasing the probability of patient satisfaction, treatment adherence, and improved health status.
So, Renee Fox and medical uncertainty. Renee Fox, a sociologist who studied under Talcott Parsons, studied the medical field and coined the term medical uncertainty. She researched how medical students and professionals experienced and coped with this medical uncertainty. And so what she did in her research was observe medical students in situations such as autopsies for anatomy classes, and the research patients or research physicians at Ward F second were observed in depth. So according to Fox, there are 3 types of medical uncertainty. The first results from incomplete or imperfect mastery of available knowledge. No one can have at his command all skills and all knowledge of the lore of medicine. 2 is the second depends on limitations in current medical knowledge. There are innumerable questions which no physician, however well trained, can as yet provide answers. And 3 is another source of uncertainty that derives from the first 2, which consists of difficulty in distinguishing between personal ignorance or ineptitude and the limitations of present medical knowledge. In other words, the first is defined by an inability of a medical professional to know absolutely everything in the field of medicine. It is also defined by the medical knowledge available to the medical professional. and medical professionals experience medical uncertainty because of the gray area between personal knowledge and the medical knowledge available in the field. So, coping with medical uncertainty. To cope with this medical uncertainty, Fox found that medical students gained as much knowledge about the situation at hand as possible when they ran into problems. They learned technical skills when they could, just as many as possible that related to situations. They used probability, reasoning, logic when diagnosing, and used a lot of humor to cope with this uncertainty. This was found in both the medical students and the Ward F second physicians.
So, according to Renee C. Fox, the regulation process increases uncertainty and makes them more manifest. And the first one is when a doctor or student doesn't know enough to give the other person an answer. So they will decide whether or not to take a guess, or they will get the information to inform someone else. And then the second one is when the uncertainty that plague risk regulations is when the doctor refuses to answer someone's question face to face because they don't have enough knowledge about it. Or it could also because that they haven't been asked that question before and they don't know how to answer it. And so doctors are placed in medical uncertainty situations on a daily basis. And new doctors are especially, they have it a little harder because they're new to mostly everything. And it can take them some time to catch up on everything with other doctors who've been helping people for years. But they could also deal with medical uncertainty just as much. But not all questions will have a perfect answer, and medical educators are responsible for dealing with these types of situations and discussing the uncertainty with their students and patients.
All right. All right, is that all right? I think that's the end of the presentation. All righty. Cool. So it wasn't 15, but I think it's okay.
I think we'll probably be a little bit more lax on it.
Yeah, hopefully. Okay, so I think I just stopped. Okay. Okay, stop recording. All right, well, I will send you guys the final video or the link if I post it to YouTube.
Yeah, would you mind if I edit one thing on the PowerPoint? I just realized that I didn't put my source in there.
Oh, yeah.
You can just send that separately to Dr. Russell.
Yeah, of course.
Okay, cool.
All righty.